Good evening, dear listeners. Welcome to another episode of our special segment where we are diving into one of the most crucial health initiatives in India right now, the 100-day intensive campaign for TB elimination. Tuberculosis continues to pose a major challenge to public health in our country, but through strategic actions and collaborative efforts, there is a clear path towards its elimination. Today, we will be discussing the specific actions and strategies behind this intensive campaign, which is designed to accelerate the fight against TB and achieve the goal of a TB-free India by 2025. For improving diagnosis and treatment to mobilizing communities and strengthening health infrastructure, the campaign is taking a comprehensive approach to tackle TB at every level. We are once again joined by Dr. Vezokholu Theyo, State Program Officer of National TB Elimination Program, Directorate of Health and Family Welfare, Government of Nagaland, who will walk us the efforts and strategies that are making a real difference in the battle against tuberculosis in India. I'm your host, Asunyo. Thank you, ma'am. Good to have you again in our studio. So, ma'am, my first question to you is, what are the key strategies being used in the 100-day intensive campaign for TB elimination or Ni-Kshay Shivir to raise awareness and prevent the spread of TB?
So in this Ni-Kshay Shivir campaign to raise awareness and prevent the spread of TB, we are putting our efforts in our IC activities, that is information, education and communication activities. Mm-hmm. And these IC activities are critical component for this 100-day TB campaign, focusing on raising awareness, reducing stigma, and encouraging community participation in TB detection drives, prevention, and treatment. Ever since it was launched on 7th December, this IC activities is ongoing activities, but for this main Shivir campaign, we have brought out print and outdoor media, posters and pamphlets. These are distributed in the healthcare facilities. Once the schools opens, the school activities, it will be distributed in the schools, in public spaces to communicate the key messages like TB prevention, early detection and nutrition. Focus on this high burden district of Kohima, Wokha and Mon. Then hoardings and standees, these are large-scale outdoor branding to reach to the rural and urban audiences. Then wall art and paintings, engaging murals in high footfall areas, reinforcing TB awareness. Then on ground engagement, we have asked the facilities, the district of Mon Wokha and Kohima to focus on street plays, addressing the TB myths and encouraging the health-seeking behavior. Then loudspeaker announcement to announce the important messages in markets and other gatherings, and broadcast on the media like radio jingles, short films and TV ads. Then digital and social media campaign, posts promoting early testing, myths about the busting content and TB awareness drives. Then influencer collaborations to engage public figures to amplify messages about TB prevention and treatment. And WhatsApp campaign to disseminate TB related success stories and informational contents to normalize TB conversations. And editorial and media engagements, Friends with TB, we will try to build a cadre of 10 to 12 journalists is in the pipeline to increase coverage on the campaign, and then media workshop, then weekly features and opinion pieces. These are some of the activities in the plan. Then we have this Ni-Kshay Vahan. So this vehicle will be equipped with the NAT machine, the X-ray machines, and the IC activities, and this will be visiting the grassroots level. So this Ni-Kshay Vahan's campaign specific branded mobile medical units is being used for this 100 days campaign. This MMU, that is the mobile medical units available under NHM to be utilized for all these activities, and the mobile medical units will have trained medical staff including the medical officers, staff nurse, lab technicians and other supporting staff. These vans would have, as I have said, the portable, ultra-portable X-ray machine. We have the handheld X-ray for Kohima. For the district of Mon and Wokha, we are in the process of hiring handheld X-ray, and chest X-ray will be done. Abnormalities in the X-ray detection, then sputum will be collected for testing, and this MMU will be used throughout the campaign. So this will focus on the early identification and diagnosis of TB cases in these vulnerable populations which I've mentioned. It will go to the remote areas, the slums, prison, orphanages, that is the congregate settings, and provide education on TB symptoms and prevention. On-site testing and diagnostic services will be done, and refer or transport confirmed cases to healthcare facilities to start the treatment. And also it will provide service for educational sessions, that is information on TB symptoms, route of transmission, prevention and treatment. So these are the main activities. Our focus also is looking not only on the treatment part, but we have this national strategic plan that is detect, treat, prevent and build. On these points, it will be focused during the campaign.
So how are the healthcare providers, such as the health departments, governments and communities, coming together to address the issue of TB during this campaign period?
During this campaign period, a holistic approach, whole of the government and community approach is focused. At the government level, ensure political commitment and support for the campaign. Then send in directive communications as per the policy decision to the concerned stakeholders and the line ministry. This is ongoing. The government need to ensure allocation of sufficient funds, address any resource gap including diagnostic, drugs and other logistics. Monitor and review the progress of the campaign. Now, in regard to the communities, sensitize and mobilize the community to participate in the campaign. These are ongoing. Ensure eligible beneficiaries are referred for screening and testing during this Shivir. Then healthcare providers. Ensure all mapped vulnerable population, including people in congregate settings, undergo screening and testing. Another is appropriate treatment management is initiated for all those beneficiaries who are eligible. Adherence to treatment is ensured. Follow-up of the patient done. Ensure Ni-Kshay Pojan Yojana benefits is paid. For every TB patient diagnosed on treatment is paid 1,000 rupees with effect from 1st November 2024. Then the food basket, that is the additional nutritional support through Ni-Kshay Mitras, are distributed, and ensure all patients are risk assessed and referred to appropriate facility. Then in case of death, we conduct a verbal autopsy and maintain the death records. That audit is done. And monitor daily of campaign progress will be conducted through real-time data and analysis and address any gaps in the operation promptly. So we have the Ni-Kshay reporting portal. So the real-time data analysis, it's happening. So all these are that holistic approach, whole of government and community approach, these are all happening.
Thank you, ma'am, for that information. Could you also highlight some of the initiatives undertaken in the state so far since the launch of the campaign? You have said earlier that this campaign started in December 7, 2024. So can you highlight some initiative taken?
The launching of the 100 Days campaign at the state level, I've mentioned on 7th December. For the state and Kohima district, it was launched by our Minister for Health and Family Welfare, Sri P. Pawang Konya, along with the legislators from the district of Mon Wokha and Kohima, with the government officials and Directorate. They all participate in this launch on 7th December at DKL ground, Sikhazu. Then other highlights are garnering political commitment. Signature campaign was done. Mapping of the vulnerable population, that is the vulnerable population more than 60 years, malnourished, diabetes, HIV, smokers, alcoholic, household contacts of TB patients. This is all done at all the facility level. Then resource mapping of X-ray, NAT, that is molecular testing, and the human resource is done. Allocation of Ni-Kshay Vahans and developing the route plan, then capacity building of our ASHAs, CHOs, medical officers, the NTP officials. These are all done for conducting this Ni-Kshay Shivir. So all this plan has been done. And for the state of Nagaland, for this to get more Ni-Kshay Mitras, volunteer donors for the additional nutritional support for TB patients, to adopt a TB patient, we had a program on 3rd December at Raj Bhavan with the governor. Because here, for this Ni-Kshay Mitra for the state of Nagaland, it is the governor office who is monitoring our Ni-Kshay Mitras. So a very good program was held for the legislators, then the administrative head of department and the head of departments.
Ma'am, you have mentioned about the volunteers donors. So who can become a volunteers donor?
Anyone can become a volunteers donor.
Okay.
Anyone can come and donate a food basket for the TB patients. And once they are registered, once they give their consent, we register them on the Ni-Kshay portal, and a certificate is given to them. And this food basket is sent across to all the districts.
So registration can be done in the government health centers, or they have to go to the health department?
We have this Ni-Kshay portal where at the Directorate we have officials who are in charge of this. We also have brought out pledge card and we have distributed with a QR code.
Coming back to role of educations and community engagements, how important it plays in the success of this campaign?
Two things here for education and the community engagement for the success of the campaign, right? So for the education part, we will be organizing art and culture activities like essay, poster and elocution competitions in schools to bring awareness on TB, sensitization of students from class 8 to 12 in school, then create youth ambassadors and facilitate taking this Ni-Kshay pledge, call it Ni-Kshay Shapat, then dissemination of awareness messages on social media and registration as Ni-Kshay Mitra from the staff of the Department of School Education. This is ongoing. Then for the community engagement, for the success of the campaign is sensitize and mobilize the community to participate in the campaign, then identify the vulnerable population and people with symptoms of TB. That means symptoms of TB, it can be cough, fever, loss of appetite, loss of pain. Also, we talk of 4 symptoms, but here in this campaign, we also include giddiness, then joint pains, swelling of leg, and these other symptoms are included for during this Shivir. The importance is given because it can be an extra pulmonary TB. So, swelling of lymph nodes, swelling in the neck, all these are part to identify the symptoms and refer to them testing center. Or wherever the Ni-Kshay Shivir is happening, the community will refer them to that camp. Then we have TB champions, or these are TB survivors. They can personally accompany people to facilities to ensure they are tested promptly, participate in the camps and case finding drives, and educate, provide psychosocial and peer support to persons with TB. Then motivate persons with TB who drop out of the treatment to resume taking their medication and complete treatment successfully. Then counter the stigma and social discrimination to ensure patients are well supported through their treatment journey. Visit persons with TB and families for preparing families as caregivers, address issues around stigma and motivate household contacts to undergo TB screening and treatment wherever required. Organize community meetings, provide an institutionalized space to create dialogue about TB and improve health services on the ground. Then share inspiring TB stories from all the TB champions identified within the district. So in all the districts, we have TB champions. These are recovered TB patients who have come forward to help in the community engagements.
Now coming to the involvement of the local government, NGOs and international organizations. So how important is the involvement of these stakeholders in ensuring the success of Ni-Kshay Shivir campaign?
Involvement of the local governments. The government need to ensure political commitment and support for the campaign by providing adequate funds and address any resource gaps. Oversee and supervise the progress of the local area. wherever the campaign is happening. Guide and orient all district level administration unit on the operationalization of the campaign. Mobilize other relevant departments like the Panchayati Raj, for us is the VTPs, the village councils, the tribal urban affairs, rural development, education, etc. for the campaign activities. Issue guidance to department which cover congregate settings, residential institutions, private sectors and other vulnerable settings to ensure saturation of coverage. Review the campaign activities on a regular basis to ensure quality of activities and desirable output. Then in regard to NGOs, our state is collaborating with the NGOs in conducting sensitization and awareness meetings, conducting community meetings, support in collecting and transport of sputum and TB prevention services. We have NGOs who are tied up with our NTEP, and these are the NGOs with whom we are collaborating for these activities. Then international and national NGOs. WHO is providing technical guidance, including supervision and monitoring of the campaign. We have JAPIGO partners who supports in the treatment adherence and TB prevention. We also have national NGOs, the Piramal in the community screening and KHPT, Karnataka Health in nutritional benefits. So these are the NGOs which are coming in to give us the guidance and for supervision monitoring and also for treatment adherence, prevention activities, screening and the nutritional benefits.
What role can an individual like me and the communities in particular play in preventing and combating tuberculosis?
Comprehensive and sustained efforts to eliminate TB are very crucial, yet unattainable without the trust, involvement and ownership of communities where TB is most prevalent. Engagement with community helps to reduce stigma associated with TB. It will increase the demand for TB services. It will deepen our understanding of needs of communities, complement the TB control efforts of the health system, and reach the most marginalized community groups. So like creating awareness and mitigating stigma by acting as you can become a community influencers, lead the community engagement and awareness activities in the locality, promote positive messaging around TB, then stigma mitigation, nutritional support, and sponsoring transport costs. These activities can help the individual and communities can play in preventing and combating TB. Also by promoting health-seeking behavior and TB detection. Sensitize community members about TB, like if you're having cough for more than 2 weeks, fever, loss of appetite, loss of weight, swelling in the neck, feeling weak, swelling of leg, knee joint pain, dizziness, then malnourished. We can come in and sensitize the community and refer them. It could be TB. So get the TB testing done. And if it is tested positive for TB, get the treatment and complete the treatment, which is very important. Then conduct health camps and other health promotion events. Participate in the health camp, screening camps, and other health-related events, both TB and non-TB, to address the needs of the groups they represent. Then activity network and collaborate with other community structures operating in the area to support patients, especially those with high risk. So like we have these TB forum meetings, you can attend, then patient support group meetings, and facilitate sessions such as preparation of nutritious food or support advocacy efforts by TB advocates to improve the quality of services. Any one of us can come in and participate in this to prevent and combat TB disease.
Well, thank you so much, ma'am, for that insightful discussion on the strategies and actions behind the 100-day intensive campaign for TB eliminations. It is clear that a comprehensive, multi-pronged approach is key to making real progress in the fight against tuberculosis, from increasing awareness to strengthening diagnostic systems and improving treatment access. This campaign is setting a powerful example of how we can tackle health challenges at scale. To our listeners, it is important to remember that each one has a role to play, whether it is supporting those affected by TB, educating our communities, or simply staying informed about the latest developments. Together, we can create a future free from tuberculosis. Thank you for tuning in. We will be back with another episode. Until then, let's continue to work towards a healthier TB-free India. Stay safe, stay engaged, and remember, every action counts.